Hi, everyone. You are listening to Beyond, and I'm your host, Dr. Flora. Listen, life is hard. You don't have to do it alone. As a mindset coach, physician, mom, and an infertility warrior, I have mastered techniques to help move you towards contentment and growth. I can't wait to go along with this crazy-ass life journey with you while making sure you feel like your best self. This podcast is meant to have you feel unstuck from your rut and less alone. Let's do this. Hi, my friends. Welcome to the Beyond podcast. I'm your host, Dr. Flora, and I just want to say I am proud of you. I am proud of you for taking the time for yourself because self-care, self-growth can never be taken for granted, and that's why you're here. I am really excited for my next guest today because self-care and self-growth are so important. You know, within the field of medicine, we are taught how to care for others in every aspect. Well, Dr. Laura Vater constantly reminds us how healthcare workers are human and need to be taken care of too. Dr. Vater is a writer, a TEDx and commencement speaker, a medical oncologist, and an advocate for the well-being of healthcare workers. Along those lines, she's done some pretty cool stuff. She's developed a wellness behavioral tool for patients and clinicians called the SMILE Scale. She's co-founded the Writing for Wellness program, which is a narrative writing program at the Indiana University School of Medicine. And she continues to encourage, share, and make almost 150,000 followers on her Instagram platform feel less alone. Laura, welcome to the Beyond podcast. I am so excited to have you here.
Hi, Flora. Thank you so much for having me and for that very kind introduction. I can't wait to dive in with you.
Of course. It's all you. This is all about you. I just read what you've done and what you've accomplished and the way you make all of us feel. So I want to stress to everyone that's listening today that this episode does not only apply to healthcare workers for the sake of speaking from personal experiences, because that's what this podcast is about. We'll be mentioning doctors, residents, but I really want you to keep in mind that Dr. Laura's advice can be applied really to all of you listening today, no matter where in life you are, what job you have, whether you're a parent or not. I really want you to take notes and take down this advice because it will be useful, if not now, at some point in time. So with that in mind, Laura, let's jump in. First and foremost, are doctors in trouble? I mean, we have gone through so many years of education, medical training with minimal attention given to how to take care of ourselves, which is quite ironic. And many of us are hitting burnout points and trying to rewire everything that we've learned. But is it too late?
I do not think it's too late. And I love my job. I love the work that I get to do. I still feel, of course I'm biased, but I still feel that taking care of patients every single day and helping them navigate through the challenges of illness is the most meaningful work that there is. And I am so glad that I get to do that work. And I want to continue to encourage people that this field is meaningful and important, and there can be joy here and there can be health here. But there is so much that's wrapped into this. I think the challenge is that we go into this medical field with our mental health and our physical health and our resilience at the same exact level, if not higher, than our peers in other fields, right? We're motivated, altruistic, and, bright. We're bringing these bright people into medical training. And what's happening is they're having all of this work-related stress. That might be long hours, demanding schedule, sleep deprivation, exposure to illness and trauma and death. And then, of course, the stigma around seeking mental health support. There may be bullying, harassment, discrimination. And you put all these things together, and these are all external factors that are occupational hazards, right? So we put a person in this environment, and it's very easy to say, oh, it must be the individual's fault. right? If you're going through this and you're experiencing, burnout, or you're disillusioned with your career, or you're exhausted, it's easy to say, okay, what's wrong with me? I know I felt that way. I don't know if you've ever felt that way, Flora, but when I was in my
Absolutely.
training, I thought, I remember being post-call, meaning I'd been awake for about 30 hours. It was after working a really intense shift in the ICU in my training. And I remember sitting in my car saying, I just don't have anything left to give. And I do not care if I make it home alive, right? I do not care if I make it home alive. And at the time, my daughter was 3 years old, and it was really her face, thinking about her and saying, this is what's going to keep me on the road. And it's really scary if you're a person that's never experienced, a mental health decline to that level, and it doesn't always disappear. For me, that kind of feeling of thoughts of self-harm and suicide persisted for a couple of months, and that was terrifying to me. And I thought it was my fault. I thought I was defective or not strong enough or weak, or that something was wrong with me. And so I have spent years of my life kind of processing through a lot of this, through reading and studying and understanding. And really what I've come to understand is that when we put a person in an environment where they have overwhelming external stress, it is not the individual's fault, but it's the system as a whole. And those are where the changes of medicine really need to come.
Wow, there was so much in that answer. First and foremost, thank you for your vulnerability. I know it's speaking from personal experience. I know it's still not easy to open up about our own hardships, especially when it comes to mental health, because we are supposed to be the strong ones, right? As women, as mothers, as female physicians, as empaths, we are the ones that are supposed to give and be there for everyone. But alluding to the fact that we weren't taught how to take care of ourselves. And we go into this field with sheer altruism. That's all we want to do is serve and make a career out of it. And somewhere in there, reality smacks us over and over and over again. And then let's move past residency, right? Practicing medicine in a broken healthcare system, to be quite honest, is really tough. Yeah. And we see the high turnover in not only physicians, but all healthcare staff trying to look for, this so-called balance, this so-called contentment and satisfaction. And it's really hard. There's no right answer for everybody, but I love how you did take control over one. You recognize what was going on, maybe not right away, but you recognize what's going on. You had a purpose, your family, your daughter, yourself, obviously. And you took control over the fact that you educated yourself, which I think is the first step. I think sometimes we bury ourselves in guilt and shame, in embarrassment, and we don't take the time or the patience. I was just speaking to Laura before we started recording how impatient I am, that I want things done yesterday. But when it comes to mental health work, regardless of what field you're on and what position you're in, it takes time, education, resources, and then consistency with all of that. So I'm one, proud of you, but two, thank you for sharing that vulnerable story, because I know it's not easy.
Yeah. Thank you. I think that it's something that I think the more we can share our own stories, hopefully it will help reduce some of that shame or that self-blame for others.
Yeah. And why do you think it's so hard, especially for women in medicine or just working women in general? I mean, I know there are all the obstacles in the world, and we could probably spend multiple episodes talking about them. But where do women fall into this, where we are at higher risk for burnout, higher risk for mental health declines?
We do know, at least in medicine, that women receive more messages from patients. In some ways, it's good that they're seen as more accessible and perhaps better communicators. And so patients actually call female doctors more often. They actually send them more messages and more detailed messages, right? So there's just that volume with the same amount of patients and more work. We also know that female physicians still unfortunately get paid less compared to their male peers. And we know that if you're married to another, let's say that your partner, male or female, is also in medicine or outside of medicine with a demanding career, that women are more likely to take on the share of parenting and home responsibilities, right? And so it's kind of like you're doing, if you're working in medicine, I just want you to know that what is considered a full-time job is really like two jobs in itself. Because a full-time job is really 40 hours a week. But even if you're only doing a few clinical days per week, when you're talking about all that requires for medicine, most of the time, even part-time doctors are working 40 hours a week. So if you're considered a full FTE as a doctor, you're probably working way more than 40 hours a week. You may be working 60 hours a week or even 80 hours a week. And then you throw on top of that any responsibilities at home or parenting that are usually at a higher level of burden compared to your partner. I think those are major, major risk factors. Often in medicine, especially, women have higher levels of imposter syndrome, just feeling like, oh, I'm not good enough. Something's wrong with me. Why am I not doing X, Y, or Z also? And then I think the other piece of this too is just this perfectionism that can be very toxic, right? If we hold ourselves to very high standards and sometimes do not have very much self-compassion if we can't do everything in our lives perfectly. So I think when you put all of those things together, it puts women at very high risk of burnout from any career.
And what would you advise on? So let's pretend we are talking to a woman who is feeling less than, who is feeling like she has done it all. She is giving her 100 out of 100 in everything she's doing. Her patients, her staff, her kids or kid, her partner, her extended family.
Yeah.
And all of a sudden,
I'm exhausted for her.
Me too, man. Me too. And I imagine this woman waking up and looking in their mirror and being like, holy crap, I got to do this all over again. I'm tired. Where should she start to help reduce her risk of not only mental health issues and there we're talking about generalized anxiety disorder, major depression, but just burnout in general, which is so prevalent nowadays?
Yeah, I would say do less. Just do less. I mean, I think that oftentimes when we have these conversations, it comes with a list of just do these 10 things and you'll be great. I think for me, I can speak to my own personal experience. What has helped me is to do less. I have been very intentional because of what I experienced in my training. I've been very intentional of setting up my career in a way that protects the things that I really care about, which for me is my family, my patients, and writing. Like those are my three things. And trying to, none of us can eliminate the rest, but doing our best to try to eliminate the rest. So just doing less. So for me, I chose a career where all of my work is 3 days of outpatient clinic. And I have some academic responsibilities because I am a assistant professor and I do some teaching responsibilities. I do some other things that come with that. But I have what I feel is a reasonable amount of patient load. I have a nurse who sits with me in clinic, an RN, who triages patient messages, phone calls, and helps me with orders and coordination of care and insurance, consenting, all of these extra things that patients need, FMLA, right? So I have a reasonable workload and adequate support, right? And that allows me to just in a day, I have less things that I'm responsible for because I have a team that helps me. And that is huge for my mental well-being. So that I can actually finish my charts and come home and be able to, sometimes it's just like, I'm so tired, I just need to lay on the couch because patient care is physically, emotionally, intellectually exhausting. But also on the days I'm not in clinic, feeling like I have freedom to write and to spend that time with my family. I also know that sleep deprivation for me is what has been linked to a decline in my mental health. And so I've been very intentional of joining a practice where I'm only on call about 4 weeks a year. And those call volumes are pretty low, where I am not working a lot of weekends, 2 to 3 weekends a year. I am not working overnight calls in-house, and those calls from home are very, very minimal. And to me, that was highly, highly important. And of course, I could be a private practice oncologist and work 2 or 3 times as much as I do, and probably make 2 or 3 times as much money as I make. And I could live in a home that is 3 times the size of what I live in. And I could have all of those things. But to me, I've been able, thankfully, to recognize, for me, carving out time to write and carving out time for my well-being is much more important. And I'm very fortunate that I still can live in a home and I can still take care of my family. And on top of that, we as a family made a decision for my husband to be a stay-at-home dad. And so now I have my husband that does a lot of he's taken over a lot of the house and parenting responsibilities, so that when I'm home, not only can I be present, but I can also write. And that's really, really important to me. Yeah.
Yeah. Oh, that's such good advice. Do less is, I think, should be our motto. But at this point, it's also hard to decipher what do less means. So I love how you described, one, delegate to family members, support staff, hire people. I mean, delegate at home and delegate at work. And I agree, especially within the field of medicine, for those who are not in healthcare, this is just the tip of the iceberg of what we do on a day-to-day basis. So for the patients who are sending me messages while I'm seeing physical patients in clinic and expecting a response within 24 hours while I'm actively seeing, I am not sitting, none of us are sitting at the computer waiting for patient messages. This is the stuff that we do in between the work that we are doing in person in clinic. This is all a part of our responsibility. This is all under the umbrella of working in healthcare, and especially being a physician. So yes, seeing patients, doing procedures, whatever field you're in, but answering patient phone calls, inbox messages, prescription refills, talking to other consultants that are also involved in care, because yes, we do work as a team. And then fielding everything in between with insurance companies, which I still don't completely understand. And there are constantly new guidelines, and there's a lot to keep up with. And it's important to recognize our load, but not only use it as an excuse. I know a lot of us will say, oh my God, I just have so much on my plate. I have so much on my plate. Yes, that currently that's the system. And little by little, I know in my own medical group, there are different plans to trial out to help decrease our burnout rates and our burden. But having support staff that works right alongside you is literally the backbone of our practices. Without them, I cannot do, you could not do what we are trained to do, and that is to treat and take care of patients and be there for them. But on the flip side, you also uncovered all the home stuff. I mean, our life doesn't stop after we leave the hospital, leave the clinic. And even if you don't have children, don't have a partner, I mean, there's just life, bills, car issues, electrical stuff. I'm still waiting for this laundry guy to come because our dryer isn't working. Like, it's just, it's life gets in the way. And then the more people you have in your family, we got to level up. And so even with my coaching clients, I always make them recognize that even if you have a 4-year-old child, that 4-year-old can still contribute. Will it be a lot? Maybe not. But it also teaches all of our family members that you are not the point person and the only point person. That this is a group project. Running a household is a group project where everyone has different roles and different bandwidths. But as a family, we are here to chip in. You're busy one day. Okay, hubby has it. Okay. Or maybe, my husband is a physician who does have a busier, much more unpredictable schedule. And I am the person that's like, oh, you got an emergency case? I got you. And I was willing to, make those specific sacrifices when it comes to hours at work. And there were certain things that I didn't want to outsource. I didn't want to outsource my child.
You. We've never done that either.
Right?
He was in school and preschool and daycare.
Of course. Yeah, we have a wonderful, she's everything to us. She's our mother's helper, our nanny, our babysitter, our house manager. And we, just like you, have a family of 3. I don't have 25 million kids running around. It's just the 3 of us. And overall, we tell ourselves that should be easy, right? The person next to me has 3 kids.
Right.
But right. But regardless, we still have this beautiful soul who helps us with pickup and drop offs when I have clinic in the morning, when my husband has an emergency case, but we made a decision that we wanted to be involved with Gia's school, with her extracurricular activities. And so wherever we can, and she understands that. And she takes pride in the fact that her parents are working and are helping in whatever capacity. So for those who are fearful of, not being there for their kid or kids all the time, 24/7, it's also important to kind of take a look at this with a 50-foot view and instill into our children that we have multiple roles and we're going to be proud of all of those roles. And they should be too.
I love that. I will just, I'll tell you, I don't know if I've told you this before, but my mom went to medical school when I was 9, and she had my parents, I'm one of 3. And so I was 9, and I had an older sister and a younger brother. And my mom went into medical school. She was a phlebotomist and said, I love looking at the blood samples, but I want to see patients. I want to see the people on the other side of these samples. And so she went to medical school, and then she finished her internal medicine residency when I was 16. So I actually watched her go through medical training. And so I will just encourage any of our listeners who are, having career changes, going back, maybe you have kids as you're going through residency or another career. Yes, you may carry that guilt of not being able to get to every single thing. And my mom worked so hard to get to every single thing. But you are also teaching your children what it looks like to go after a really, really hard goal and to be gritty and to keep going against obstacles, even when you want to quit. Because there were so many times my mom says, I want to quit, but I can't let my kids see me quit. And now she's done rural primary care for more than 20 years. And she's going to keep practicing, even though she could retire, because she just loves her patients. And so I just want to encourage those of you who feel like you might feel that guilt of not being able to be there for every single thing, that your kids are also seeing you in a professional role and go after hard goals. And they're going to learn from that is possible for them too, if they choose to do that.
What a wonderful call out. Also, I bow down to your mother. And your father. Holy moly. I mean, what an amazing feat. And what a wonderful example that you had growing up.
Yeah. My dad, it was just like a 180. Like she was kind of one day a week, worked one day a week. She was like almost a stay-at-home mom when I was a kid. And then they just like kind of swapped. My dad took over kind of all the house responsibilities while working full time. And so we had a lot of family and we didn't have any family in town, but we had a lot of friends who would say, yeah, I'll carpool here and we'll take you here. And, and I'm really grateful for that we had a lot of incredible kind of friends that helped out during that time. But shout out to my dad. It does take a
village. It takes a full village. I mean, and it doesn't all have to be blood relatives. I understand that. I'm going to stress that again. So let's talk about you then. Was your mom one of your influences in getting into medicine, and then everything else that you've accomplished since then?
Oh, certainly. It's funny. My mom always jokes that I knew I wanted to go into medicine before she did. And she and it's kind of funny, but of course, as a kid, she actually took me to the cadaver lab when I was like very young, probably too young, but like I got exposed to, she took me rounding with her in our small hospital. I got to observe surgeries and things from a very young age. And so I definitely, it took me longer to make sure that I wanted to go into medicine. So I took about 3 years after
Mhm.
college before I went into medicine because I knew the commitment that it took. I knew how hard it was going to be because I'd seen it kind of day in and
Yeah.
day out. And so I took about 3 years to really discern that. But then it was like, this is the only thing I really, really want to do. And so then I kind of jumped in. But certainly it gave me a better understanding of what I was getting into, but then also just more a deeper level of knowledge of how I wanted to set up my own career too.
Yeah. What a blessing. A lot of us didn't know or had the wrong impression or a different impression of what their life was going to look like. And it's almost jarring to be at a point where you're like, wait, I checked all the boxes off and I'm still not feeling content. And so I love that you had that clarity and that insight through your mom's example, which is so beautiful. How did you get into social media? I mean, I followed you forever. And every time you post something, whether it's a repost from someone, I mean, everything is so poignant. And I'm like, oh my God, Laura's talking to me again. But you're such
I love your content too. Oh my gosh.
Thank you. Thank you. You're such a beautiful writer and you have such a beautiful way with words. And they're emotional, they're tactful, and they hit people. I mean, it's obvious to me, but why did you get into social media? How did you get into social media? It is a big commitment.
For a long time, I had like zero social media presence for a very long time, kind of all the way through, college and my graduate program and then med school. And then I had my daughter. I was a non-traditional student, so I said, yeah, okay, we either can have we can either have our kid, our first child in medical school or after I'm done, or maybe try to fit it sometime in during residency or fellowship. And my husband and I really didn't want to wait until we were done with training. And so I had my daughter when I was 28 as a fourth year medical student. So I was pregnant during nearly my whole third year of medical school, which is,
Wow.
a whole other story, but a whole other challenge. But then I was this new mom in medicine. I didn't know anyone really that was on the same path as me, medical student and a mom and going into residency and all of this. And I was just really looking for community online. That's really my first reason that I even went into social media, is that I found people that were also mothers in medicine who talked about their real life experience, many of them after they were done with training. And it just really helped me feel less alone. And then kind of my page and what I write about really evolved from there, from kind of a lot of motherhood and medicine, and then kind of really into this, my own reflections of residency of, is this sleep deprivation really ethical? Is this
Yeah.
a rite of passage or a violation of human rights? And that's really when I started to experience some of my own mental health decline. And then, of course, it's just like kind of organically gone more into that sphere of really humanism in medicine, compassion in medicine, and the well-being of all healthcare workers. Because I really see it from an ethical perspective. And so that's where a lot of my writing now is. But of course, I came to it really, really just trying to find others who were on a similar walk of life. And I'm so glad that we connected in that space too.
Yes. Yes. I came onto social media with a very similar ask, a request. I was going through infertility and I'm like, nobody around me is going through this. Like, I can't be alone. And I needed to share because it was cathartic. And I just started posting personal stories about my journey. And gosh, I found a whole community of IVF warriors, which I know now it's in your face. If you're on social media, there is a huge community. But 5 years ago, that really, maybe 6 years ago, that didn't really exist. And so to have that blossom into whatever you have, I mean, it's beautiful, it's relevant, and I'm going to ask you this question next, but I see slow changes being made in certain training programs. But I don't know, from a coaching client standpoint, I have had a variety of medical residents come to me from various training programs, and such a wide array of foundations within their training programs, everything from complete toxicity, and I'll just say that, to programs where they are prioritizing the mental well-being of their trainees. Do you see this changing? Are you seeing changes being made? Is it slow? Is it as slow as I think it is? Or do we have to wait a long time to see this truly implemented in training programs curriculums?
Yeah. I will tell you that there are a lot of amazing people that are doing incredible work in this sphere, that are working very hard to protect the well-being of residents. That also being said, it's very program specific and it's hard to predict.
Yeah.
Let's say you're trying to match into a program. It's really hard to figure out, do they really care about my well-being or not? And we can talk, if you'd like, a little bit more about how can you decipher that.
That was going to be my next question. But yes, continue, complete this, and then we'll move on.
Yes. Even at, so for example, at the residency program where I trained, and I'm now a professor at the Indiana University School of Medicine, and I do, I did my fellowship in hematology oncology as well as at Indiana University. On our medical campus, we have nearly done away with sleep deprivation in our internal medicine residency. I think they have a single 28-hour call in their whole residency now, which is a huge change from when I was a resident. I think I did like 60 a year or more. And then they have opt-out counseling, meaning you're automatically enrolled in counseling and you actually opt out of it. So it's like you're actually scheduled for it. So it's trying to normalize. So that's a really great
that
change.
Makes my heart so happy. So happy.
A lot of programs are doing that. A lot of programs are doing peer support where they're essentially matched. An intern is matched with a third year or with a group. And so there's peer support. So some of these things like dealing with grief over patient care or a medical mistake, or just feeling mental health decline, or even substance use, these things are more supported. And so those peer support groups have some good data behind them. And then at our fellowship, our hematology oncology fellowship, we used to have a week at a time of home call where we would be covering a BMT unit, bone marrow transplant unit, which is an ICU or a critical care unit. So just very sick patients, lots of calls at really all hours of the day and night. So sometimes we'd get called every 20 or 30 minutes all night long. And then we'd work all day for a week straight, right? I mean, and it just was not safe. It took us 4 years to finally get the budget and staffing, but now we actually have nocturnist, which is a doctor that works night shifts that covers that bone marrow transplant unit, so that the fellows or the kind of the subspecialty trainees, they are not covering those calls at home. So it's just offloading them, and it's made a significant difference. And so I will say that this is not just our program, people reach out to me across the country that positive changes are happening, and they're very program specific. And so I will just want to encourage you that it sometimes takes time to recognize what is not working and to have the professional security to be able to raise your voice and come up with solutions. And those solutions, they don't happen overnight. They take oftentimes months to years of working through barriers. It's often funding and staffing issues, and that there are really good people that actually really do want to make these solutions happen. So be encouraged by that. And for any of your listeners who are residents, I will just say that you may not feel like you're at a place where you can say anything yet. But if you're in a place of as a chief resident or even upper level resident or a leader in that, always try to make things better than you found them. And it can be very hard to be in that position. For me as a resident, none of these changes applied to me, or as a fellow, but now thankfully all these changes apply to those that have come after us. And those residents are then going to go on to make changes to make things better for the people that come after them. We have a pregnancy policy that we've enacted, which basically means if you're not going to experience sleep deprivation in your pregnancy, because that can cause all sorts of problems. for pregnancy and for the baby. And so there are important things that happen to kind of come back to how do you decipher? Like, let's say you're trying to figure out where to train or where to get a job. How do you really like read the tea leaves? How do you figure out like, is this a program that's going to support me or not? Sometimes like they might say, oh, we have this whole curriculum for wellness or well-being, and it may be a whole host of online modules, but that's probably not going to impact your well-being very much. What really impacts well-being and health is a schedule. How many hours are you going to be working? What's the call schedule like? Are you going to be experiencing home call or sleep deprivation on a regular basis? And do you have accessible and free mental health support that's not stigmatized? Is there a way to report toxic cultures or toxic people that really protects your anonymity? That's really, really important, and that can be hard to decipher. And a lot of times you can reach out to residents who are in that program and try to ask some of these questions. That's perhaps the best way to try to go about it, but it can still be very hard.
Yeah, and uncomfortable, right? Especially if it is a job or a position that you oh so dearly want. And the same thing when you are looking for, I think this could apply to really anywhere, not only medicine, but specifically talking within the field of medicine, because that's what we're both in. I think those are valid questions to ask when you are done with training and looking for your first job. I still remember when I had graduated, we knew we wanted to stay in Los Angeles. My husband was doing a fellowship training, and I kind of scattered a pretty wide net of applications, knowing that I may have to commute, knowing I may have to make some sacrifices. We didn't have a child back then. And I remember going into this interview and I asked very easy questions. Will I be going into the hospital? So for those who don't know, I'm an outpatient internal medicine physician. I did not want to take call. That was the one thing, like you, Laura, sleep deprivation for me is such a large trigger for both mental and physical health decline that I learned it very quickly during residency. And we didn't have the protection that some programs or even my old program has now against sleep deprivation. But I knew I didn't want to take call. And so I asked point blank, how many calls a year do I have to take as an outpatient physician? And he's like, I am not sure. Flag number one. Then I continued to ask, will I need to go into the hospital and round on patients? The answer was maybe. This is a reputable program. This is a reputable company here in Los Angeles, by the way. So it wasn't just some random private practice that I was looking into. They had, they're very well known, they're well staffed, well funded, but these were the answers I was getting. And I remember thinking to myself, I know I'm desperate for a job. I know I need to make money. My husband's in fellowship. He's going to be making next to nothing compared to what we need to make a reasonable living here in Los Angeles. So yes, that pressure was on. And I think sometimes we think about what's at stake and it keeps us from asking or making pertinent decisions. I'm going to also take this a step further. I had a coaching client, love her to death. She was a resident and she was in a very toxic program. It was impacting her physical health, her mental health. There were just lots of different variables that were going on. And I remember we did this exercise where I wanted her to think outside the box. As checklist people, right? Women, type A, stereotypically in medicine, we go by this checklist like, okay, we're done with this. Next exam, next year, next step, next position.
Totally.
I asked her, okay, after you're done with training, what is your plan? And she had a plan. I'm like, okay, what if you decide to apply to a different program and transfer mid-training? Laura, her jaw was to the table. She's like, I do not comprehend because that throws my timeline off. You don't understand. I'm this many years old and I have a plan. I have a checklist. I hear you. However, kind of along the lines of what you were saying, it may be uncomfortable, but it's important to put you first. And that may impact your quote unquote timeline, but is it worth your mental well-being? Is it worth the time it's going to take to pull yourself out of the very, very deep hole that in some scenarios you're continuing to dig yourself in because of external circumstances, not your fault? But I really had to spell it out for her. And she ended up applying to different programs. And that was, I don't think only my doing, but again, just the realization of this sucks. And I do have control. I can take control at some point in time. Maybe not all, especially within training, but think outside the box, be creative. It's okay. It's nothing is worth the mental health sacrifice in my eyes.
I love that. I think that whether you're in training or in a job of any kind, you can have this feeling of being trapped, that you don't have options, you're not of value, that you don't have negotiating power. I think a lot of doctors are taught that early on, that they're replaceable or that they're not valuable. And so I hope that people, I'm sure they do because they listen to your podcast, but just know that you have value, that you have negotiating power, that you have options. You can walk away from things that are not working for you, and that you have no idea how many people have been able to do this successfully and wish that they could tell their younger self, hey, your mental and physical health is not worth this. Yes. You're valuable and there are other options. And I wish that more people in medicine knew that.
Absolutely. Speaking of the younger version of yourself, Laura, if you could look at the training version of yourself. There's Dr. Vater. She's an intern, go-getter. She worked hard to get to this spot. She has a child. What would you tell the younger training version of yourself that would maybe change your trajectory in a good way?
To step into who you are without fear of what other people think of you. It's funny because I have internally been a writer for a very long time, and I thought that no one would take me seriously. Hematology oncology is like a very research-focused field.
Yes.
And so I came in, I was like, okay, if I'm going to go on this path, I have to be so focused on these research things with my mentors. And so I had actually written a whole novel. I'd come up with this, health behavioral tool called the SMILE scale. I'd done these things, but I didn't tell my mentors about any of those things because I thought that I don't really know what I thought, but I thought that perhaps it wasn't as serious of an endeavor than this either bench science or public health or other health services research. And it wasn't until the end of my fellowship that I told my mentor about these things. And he just gave me this look of shock. He's like, you've written all these narrative essays and published them, and you've written a novel, and you have created and trademarked this tool, this health tool, but yet you don't even put it on your CV. Why? And I'm like, I don't know. I think that I was so afraid for so long that I was outside of the quote unquote box of what a serious oncologist looked like, and that I was afraid to step into that. And I just wish I could tell my younger self, embrace who you are, claim that, spend your time doing that, and have fun with it. Instead of just trying to pretend that you're something you're not.
Yeah. And that's a part of the imposter syndrome that so many of us feel going into anything really, but specifically in medicine, especially in these hierarchical training programs where you are expected to listen and follow, rightfully so. I mean, let's be honest, as an intern, I didn't know what I was doing, but to a certain extent, it indirectly or directly also tells us that we don't have a voice and we can't build on our uniqueness because we need to follow a certain guideline regimen. So I love that piece of advice. Would that be something, would you say something along the same lines to say any first year, whether it's first year med student, intern, first year attending, what would you say to someone that's sitting in your room being like, it's my first day?
I think first of all, I would tell them that they don't have to have any idea what they want to do, because I think that, it's easy to say, oh, step into who you really are and what you really want. But a lot of times you don't really know what that looks like right away, and that's okay too. So I would say both. Explore things that are outside the box, be creative, and just be open-minded, and be kind to yourself if you don't know exactly where the path is leading you, and be open to different opportunities. But once you kind of have this understanding of the things that really are meaningful to you, or where you derive joy, that are even tangential to your work, step into that. Yeah. And don't be afraid to explore those things, even if they're different than what your peers are doing.
Yes, that is so important. The idea to assimilate with our peers or surroundings, what culture, society told us to do, it's a daunting task to go against, and it can feel uncomfortable, wrong, shameful for whatever reason. But I love that piece of advice. That's like great life advice in general. It's okay to not have a clear set vision of what you want to do, but develop that gut instinct. You develop that trust in yourself, so you can get clarity as you go through life and what to do next. I remember I went into undergrad as a business major just to spite my parents, because they wanted me to go into the sciences. And the first year of my college career, I ended with a 2.7 GPA. And for those who don't remember it, that's bad. That's horrible. That's awful. And I remember thinking to myself, I can't do anything, regardless of what field. With this GPA, I cannot do one thing. And so I remember feeling horrible. I was so embarrassed because I was trying to prove a point to my parents and to like society in general, and realized, okay, wait, maybe this is not for me. Let me start dabbling into other fields and other classes, and eventually landed on physiology. So like cliche, like brown girl in, physiology, then turned pre-med. And then I also remember, I also took some time towards the end of my college career to just not jump into medicine because I wasn't sure. And at that time, I was dating my now husband, and he had such a clear vision, Laura. He knew, maybe not exactly, but just the general categories of what he wanted to do with his life. And compared to him, here I was just like jumping around and really not knowing what I wanted to do, but kind of having an idea, but not really confident in that idea. And it was such an interesting non-parallel relationship. And a lot of that, I think, did deal with self-confidence and imposter syndrome. Like, am I good enough to do this? Am I resilient enough to go through the grueling medical training and whatever I decide to do afterwards? What if I don't make it? What if I fail? Like all these what ifs, like these catastrophic what ifs, when in reality, if it did not work out, I could pivot. Yes. And it's not something that we tell ourselves when we were younger. And it's something that I'm still trying to remind myself and my daughter, who unfortunately takes after me when it's like, I can't do this. This is not going to work out. Oh my God, the world is over. And so, children humble us, but I think this is a good time to also teach them, and anyone who is going through what we went through, it's okay. It doesn't feel okay, but it will be okay. And nothing is all or nothing, really.
Yes. I did want to share on the same thought. I really thought this was great. In Elizabeth Gilbert's book called Big Magic, she talks about passion, because, sometimes they say, oh, just go after your passion. Sometimes we don't really know what that is, but she says, go after your curiosity. Is there just something that is just slightly interesting to you? She was between books. She didn't know what to write next, and she had moved to a new area, and she she saw a beautiful garden. She said, gardening, that's kind of interesting. Okay, where did this flower come from, right? Oh, that's a little interesting. And so just one step at a time of curiosity. And she ended up writing this novel about this family of like botanical explorers,
oh my gosh,
right?
wonderful.
But like, so just this tiny little creativity became this much bigger thing. And I think that just allowing ourselves to be curious and just exploring things just a little bit at a time and not putting that pressure on yourself that you have to find this like all-consuming passion that's going to drive you for the next 70 years of your life, and allowing yourself to evolve over time. All of us, our interests are going to evolve over time. So will our partners, so will our friends. And so supporting each other as our interests evolve over time, and then being kind to ourselves if those interests evolve, and just following that curiosity.
I love that. What a wonderful kind of closing message here. Follow your curiosity and be yourself. I mean, they're so simple, right? Be yourself. I mean, I tell my daughter that all the time. I tell myself that all the time. But I think, with time and age, we gain confidence in who we are, and we do truly find ourselves in what we want to follow through with. But I love the fact that we're trying to also impact those who are not quite there yet. And, there are certain people that are wired with curiosity, wired with exploration, wired with such clarity. My husband's like that. He is that. He follows, he's always been like that, follows with curiosity, has no minimal imposter syndrome. And I remember, we've been together for 20 plus years, but I remember when I was in my not so confident stage of my life, I remember being really envious of him. And if you're in that state where you're just feeling the imposter syndrome and you kind of look over and you're like, I want to be like that person, but I'm not that person. I'm not wired that way. Be curious. Try one small step at a time. That's all it takes. These are mountains we're climbing, not fun little flat roads.
I love that. That's so true.
Laura, where can people find you? You have multiple resources here.
Yeah, I have a website where I have a lot of free articles for people in training, or, just tips for people that are not even in medicine for how do you find health and joy as you go through your life. That's on my website, just lauravater.com. I'm also active on social media, probably the most active on Instagram. And that's just at DOCDoc Laura Vater. So yeah, I'd love to connect.
We are going to post all of that in our podcast information page, so y'all can just go over and click on those links. It'll make it easy for you. Laura, I appreciate your time. I'm grateful for everything that you've taught me, everything that you continue to do, and all the wonderful words that you put out there that are so meaningful for not only me, not only readers, but our listeners today. So thank you. I really appreciate you.
Thank you, Flora. Thanks for having me here and for all that you do.
Of course. All right, Beyond listeners, we got another amazing episode. Check, done. I want to hear what you think about this episode. If you want to share a personal story, if you want to vent, if you want to give me feedback, I would love to hear it. Follow me at Dr. Flora Sinha. You can also follow the podcast page at _Beyond Podcast. You can email me at florasinhamd@gmail.com. There are so many different ways to hear from you. Take action. Thank you for being here. We'll see you guys next time. Bye. Thank you so much for joining and spending your precious time here with me. As someone who prioritizes her energy, I am so grateful that you chose to spend yours here. To help me help you, please take an extra 30 seconds of your time to rate and review the podcast on your listening platform. For more tips and a behind-the-scenes look into my life, follow me on Instagram at Dr. Flora Sinha. That's Dr. Flora Sinha. Finally, connecting with you truly fills my cup. So DM me on Instagram, email me at florasinhamd@gmail.com, repost if you love this episode. I love hearing from you. I am so grateful for you and cannot wait to be back for the next episode. Bye.